Hi guys, today I'll discuss about a very serious topic that is coronavirus. All the contents are taken from WHO website. So let's start.
First of all, I'll discuss about some frequently asking questions and answer about coronavirus. What is coronavirus? Coronaviruses are a large family of viruses that are known to cause illness ranging from the common cold to more severe diseases like Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). What is novel coronavirus? A novel coronavirus is a new strain of coronavirus that has not been previously identified in humans. The recent coronavirus that is spreading throughout the world from China, that is a novel coronavirus. There is no specific name given to the coronavirus, and in the case sheet or history sheet, the specialists are writing 2019 coronavirus, 2019 coronavirus. Can humans become infected with a novel coronavirus of animal source? Detailed investigations found that SARS coronavirus was transmitted from civet cats to humans in China in 2002, and MERS, Middle East Respiratory Syndrome coronavirus, was transmitted from dromedary camels to humans in Saudi Arabia in 2012. So, history saying that coronavirus can be infected from animal source. Now, recent days, the novel coronavirus is 2019 in China. The scientists are suspecting that bats or snakes, they are responsible for the transmitting of this coronavirus, novel coronavirus 2019, from animal to human. What are the symptoms of someone infected with coronavirus? It depends on virus, but common signs includes respiratory symptoms, that is fever, cough, shortness of breath, and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure, and even death. Can coronaviruses be transmitted from person to person? Yes, some coronaviruses can be transmitted from person to person, usually after close contact with an infected patient, for example, in a household workplace or healthcare center. Is there a treatment for a novel coronavirus? There is no specific treatment for diseases caused by a novel coronavirus. However, many of the symptoms can be treated and therefore treatment based on the patient's clinical condition. Moreover, supportive care for infected persons can be highly effective. Before going to the protection part, I would like to discuss one last questions, that is there any vaccine available for coronavirus, novel coronavirus? The answer is no, because this novel coronavirus or 2019 coronavirus is a new strain of coronavirus. WHO website clearly says that it needs some years for development of the vaccine for this new coronavirus strain. So as of now there is no available vaccine. So the best we can do for protecting ourselves from this coronavirus by taking some measures. What are the measures? What can I do for protect myself? So there are some public advice from WHO. Wash your hands with soap and running water when hands are visibly dirty. If your hands are not visibly dirty, frequently clean them by using alcohol based hand rub or soap and water. Wash your hands after coughing and sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, when handling animals or animal waste. Protect others from getting sick. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue. Throw tissue in closed bin immediately after use. Clean your hands with alcohol based hand rub or soap and water after coughing or sneezing and when caring for the sick. Protect others from getting sick. Avoid close contact when you are experiencing cough and fever. Avoid spitting in public. If you have fever, cough, and difficulty breathing, seek medical care early and share previous travel history with your healthcare provider. Use different chopping boards and knives for raw meat and cooked foods. Wash your hands between handling raw and cooked food. Sick animals and animals that have died of diseases should not be eaten. Even in areas experiencing outbreaks, meat products can be safely consumed if these items are cooked thoroughly and properly handled during food preparation. Stay healthy while traveling. Avoid travel if you have fever and cough. If you have a fever and cough and difficulty breathing, seek medical care early and share previous travel history with your healthcare provider. Avoid close contact with people suffering from a fever and cough. Frequently clean hands by using alcohol based hand rub or soap and water. Avoid touching eyes, nose, or mouth. When coughing and sneezing, cover your mouth and nose with flexed elbow or tissue. Throw tissue away immediately and wash your hands. If you choose to wear a face mask, be sure to cover mouth and nose. Avoid touching masks once it's on. Immediately discard single used masks after each use and wash your hands after removing masks. If you become sick while traveling, inform crew and seek medical care early. If you seek medical attention, share travel history with your healthcare provider. Eat only well cooked food. Avoid spitting in public. Avoid close contact and travel with animals that are sick. Wash your hands with soap and water after touching animals and animal products. This is for shopping in wet markets in China and Southeast Asia. So, for them, wash your hands with soap and water after touching animals and animal products. Avoid touching eyes, nose, and mouth. Avoid contact with sick animals and spoiled meat. Avoid contact with stray animals, waste, and fluids in markets. Working in wet markets in China and Southeast Asia, stay healthy. Wear protective gowns, gloves, and facial protection while handling animals and animal products. Remove protective clothes after work. Wash daily and leave at the work site. Avoid exposing family members to soiled work clothing and shoes. Frequently wash your hands with soap and water after touching animal and animal products. Disinfect equipment and working area at least once a day. So last of all, I want to conclude with a quoting that an ounce of prevention is worth a pound of cure. Prevention is always better than cure. Thank you very much for patient listening. We'll meet in next video.